and this is Trina Edwards Boyles, and welcome to Healthcare Cares. And before I get started, let me share with you I'm not a medical doctor. I am here to help you with your benefits and how to utilize your benefits. So, today I'm going to go over eligible medical expenses and also general exclusions and limitations. So, first, let me start here. I received an email. How do I know what is covered, Trina? I get this EOB and it's telling me, no, this is not a part of your benefits. So, at the time that you enroll into your new benefits, or if you're in the middle and you still have 6 months down the road, look at your benefit booklet. If you don't have one, go to HR. Say, I need to see my benefit booklet. I need to know what's covered and what's not covered. So, medical eligible benefits. Well, what's covered? It's an expense. Doctor visits, preventative care, physical therapy, mental health, ambulance, and emergency room visits. But I got to put a big question mark there, simply because it has to be a true emergency. Okay? I'm replying to that individual who sent me an email saying, I took my daughter to the emergency room and now I got a bill in the mail. I thought this was supposed to be covered. Well, health plans, employers, they're like, what can we do? We can handle the true emergencies, and that's fine. That's totally fine. But those of you who go into the emergency room because you don't want to take off work, or you have a bad headache, but it's not a migraine, you stub your toe, anything that's non-emergency. Non-emergency means that you can wait and go into your doctor's office the following day, the following Monday. With this coronavirus going on, you can call your doctor's office, schedule an appointment, speak to your doctor. Hey, I don't know, I stubbed my toe, it's still swollen. He may refer you out to an x-ray and do a follow-up call to give you the results of the x-ray. I want you to use the emergency room visits for emergencies. Simply, we have so many people going into the emergency room these days due to the coronavirus. If it's something that you can wait, now you having chest pains, don't wait. Certain things that you can wait for, your daughter has a tummy ache, you don't know what's going on. It just started after she ate spaghetti for dinner. You can still call your doctor on the phone and let them know. I'm just asking you, please, those who have those symptoms and those who truly need the emergency room visits, let them go to the emergency room visit, because you may get that bill in the mail saying this is non-emergent. Therefore, you'll have to pay for it. If you haven't met your deductible, you'll have to pay for it. So, I would ask you to please utilize your benefits. Look in your manual. You get them every year. I go online. Some people can go online and look and say, okay, what can I do? How do I handle this? Okay, they said this is a covered benefit. Okay. You can appeal if you get a denial in the mail. And sometimes they will overturn that appeal. I'm empowering you to utilize your rights so that you are not getting all these bills in the mail. None of us want them at all. So let's talk about general exclusions and limitations. You let me give you some things that are what we consider exclusions: cosmetic procedures, acupuncture, adoption, tattoo removals, genetic testing. Now, solutions can vary from health plan to health plan. And that's why I'm asking you to look in your handbook for your benefits or call the 800 number on the back of your card. Because some of these may be payable and some of these may not be payable. Now, I want to save you a little bit of money here. When you enroll, we have what we call a flexible spending account or an HRA or a high deductible plan. So the HRA and the flexible spending account, it's saying, what can I do? These are ways you can save money when you get a bill in the mail, or if you know, hey, I'm going to need to go to the doctor, I may have to have surgeries, or if you frequent your doctor quite a bit, you want to contribute to one of these funds. Not everybody have flexible spending accounts. Some of them have high deductibles. And when you pay into those accounts, what they do is they take money out of each one of your paycheck. You decide how much money you want to take out for the year. Some health plans have a limit. Some say you can only take out $1,000. Some $500. You need to take a look and say, what services am I going to need? What's going on? You may be having a root canal. We all know how expensive those are. So, you want to like, okay, what can I honestly do if I have a root canal? And it's going to cost me quite a bit of money. Now, some plans will give you like a little mini a credit card. So when you go in and you have an out-of-pocket expense, you can use that credit card. Some plans will say, hey, we paid, she has a co-payment, so we're going to send her a check in the mail to pay her back. You only have so much money, and when you exhaust whatever you decided to put in to your flexible spending account or to help you with that high deductible, this is what they will utilize to help you, to get you through. For those services that are not covered, hey, you can pay with them with your flexible spending account, your HSA, you can contribute there, your HRA, you can there. Also, with this card you have, or some will say, turn in your receipts, you can even purchase over the counter aspirins, cough medicine, anything that's medical. You are saving yourself a whole lot of money. You may not have the money at the time, but you have this flexible spending account card that has $500 on it, and you have a child at home that's sick, and you're like, okay, wow, what do I do? Hey, use that flexible spending account, especially when you have exclusions. Now, when I speak about cosmetic is part of your eligible expenses. Cosmetic is also a part of your exclusions. Okay, so what do I do and what does that mean? Well, I live here in Los Angeles. Everybody would love for higher cheekbones, a tummy tuck, lips protruding, nose smaller. Your health plan's not going to pay for that. That is something that is cosmetic. Now, if you had breast cancer and you needed reconstruction surgery, that's something they will pay for. That's something you will have to go over with them. As I stated, every health plan is different. The health plan and your employers get together, they come up with the type of benefits they want and the type of benefits they want to roll out. And I tell you, read your benefits, your exclusions, and you're eligible. Read them because they can change. Some can say, well, wow, hey, they're gonna start paying for this. Great. And sometimes they will say, they excluded this benefit, but I had it last year. You have to really, 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 truly be aware of the benefits that you have. And if you're during your open enrollment, if they offer you the HRA, the high deductible, the flexible spending account, then I would take it. Do they take all that money out on one paycheck? No, they do not. They divide it amongst each month, and that's how much they take out. A lot of times, they'll give you that whole $500 at the beginning of the year, but you'll still be paying throughout the year out of your check. Other plans, they may not do it. That's something you need to check on. But I'll bet my bottom dollar that flexible spending account, that HRA, all those HSS, please contribute. Also, with your flexible spending account, you can use it to pay daycare. That is a very good thing to do. They may ask you to turn in your receipts, and I believe now 9 times they ask you to turn it, but then they pay you back your money. You're saving money as you go along. You always want to tell yourself, what can I do? What can I save? How can I save? These medical bills are totally overwhelming me. What can I do? Get you a flexible spending account. So when you go in and you don't have money to pay for your RX or your pharmacy medication, you can use it for that. There's so many different ways that you can use these type of programs with your employer that will help you out a lot. Now, genetic testing. I've noticed over the years, some will say no. Others will say yes. And when you speak about genetic testing, you think about, okay, everybody in my family had this one disease or this one thing that's going on, and you want some genetic testing done. Sometimes they will pay for it. It depends on why, where you're having it done, and it will only cover the member unless the member has dependents. Now, that's another benefit you need to take a look at and know about it. Genetic testing is very expensive these days. Your flexible spending account can also be used when you go to the acupuncture. They're not covered. I don't know if they'll ever be covered. But right now, I know they're not covered. So you have ways to get around doing a lot and managing your health care, managing your out-of-pocket expense, managing those high deductibles. You have a way to get around all of it. If you have questions, hey, hit me up. Healthcare.cares, CARES, @gmail.com. Be safe, be healthy, and stay at home. Take care of yourselves and watch me every Wednesday at 3 p.m. You can check me out on my website, go to my Facebook page, or my YouTube, and you will be able to see all these. You may want to backtrack on some of them, but I'm here to help you. I'm here to empower you to let you know that you do have control over your health care and what you spend out of your pocket. Thank you, and I'm out. Trina Boyles with Healthcare Cares. Take care. Bye bye.